Hello and welcome to this week's episode of GIANT's Healthy Innovators TV. My name is Barry Shrier and I'm your host. We invite everybody to go to the GIANT website, www.giant.health, to learn more about our organization and our flagship annual event. We are producing the GIANT Health event, which this year is on the 6th and 7th of December in London. And it is, according to the Financial Times newspaper, the UK's largest, most valuable annual event in the world of healthcare, technology, and innovation. According to the BBC, we're the UK's leading magnet for innovation. So we're delighted to be convening everybody whose business is healthcare, technology, and innovation. We hope all of our listeners from around the UK and around the world will be able to come and meet us in person in London on the 6th and 7th of December. So welcome to this week's episode of Healthy Innovators TV. Every week we love to bring you leading innovators, people who are at the forefront of creating new innovations in healthcare. And our job is to help promote these innovators in order to allow the healthcare sector to adopt new technology more quickly. Our vision is to improve the health and the well-being of people around the world by facilitating the adoption of new technologies and accelerating new innovation in healthcare. So this week, I'm very, very happy to introduce you to John Payne. John is from Intersystems, who's a really prominent and important sponsor and supporter of GIANT Health. You may have seen them at our event last year and in previous years. So John, welcome and nice to see you.
Nice to see you too, Barry, and thanks for the invitation to be with you today.
Well, it's a pleasure. Really looking forward to having you guys at our event in December, and I'm looking forward to our conversation today as well. So I'm grateful for your time, John. So to begin with, if you don't mind, maybe you could just share with our listeners a little bit about you and your career and what you're working on these days.
Okay, well, I guess my background goes back some way. I'd started out working in software, actually for the NHS in the 1970s.
Wow.
Since then, my career spanned financial services, where I spent a lot of time doing trading systems in various different countries around the world. But more recently with Intersystems, I've been here for the past 20 years, where my work has covered a number of different markets, as Intersystems does, but it's primarily associated with healthcare. And the main thing that I do is look for ways to help people take best advantage of new technology.
Nice. Excellent. Well, that's exactly what we're here talking about today. So good news. And again, looking forward to our conversation. So John, to begin with, what do we mean when we talk about innovation in healthcare organizations? I guess it's a popular word. It's used all the time, but it's really valuable to get some clarity on that, isn't it? So if you could help us to understand that from your perspective.
And I think innovation really, from a healthcare perspective, and particularly from an NHS perspective, is currently about improving the quality of care at the point of care. Right. And what I mean by that is looking for new ways to work with data, to work with people, to support more rapid delivery of care, more rapid diagnosis, more rapid treatment, but also doing so in a way that enables people to take control of their own health. And really, it's not just about providing data to the right point and the right time to the clinician, but also you and I as individuals being able for us to take more ownership of our healthcare and to improve it.
Yes. That's extremely interesting and spot on as far as I'm concerned. We talk all day long and every week and throughout the year about innovation, and often people say, well, it's about a new product or a new capability or a machine that can do something new or different. And that's only part of it, isn't it? And I think what you're alluding to is fundamental. We know that in the UK, as well as in every country worldwide, we have aging populations. We have new diseases like type 2 diabetes. We have new challenges like pandemics. And this creates permanent growth in the demand for healthcare, obviously. And we don't have permanent, unlimited additional financial resources to deliver healthcare, do we? Therefore, this innovation has to be not only technology which empowers and enables clinicians to do more, but it also has to be about encouraging individuals, us, citizens, to take our own health into our own hands and to live healthier lives and to concern ourselves with our own health rather than just saying, oh, well, I'll wait until I'm unwell, having pizza and beer every night of the week for years. And then when I'm unwell, I'll go see the doctor. And that might have been the mindset 50 years ago, but that's not going to work going forward, is it?
No, and it's this move from a break-fix sort of a health economy, where, as you say, when people get broken, they rely on the NHS to fix them. To people taking control of their healthcare, doing what's necessary to maintain and support their health themselves, but then using the NHS or taking advantage of services offered by the NHS when that becomes necessary. Which that's what the NHS is for.
Exactly. Yeah. Cool. Hey, well, look, thank you for that. So obviously your company, Intersystems, clearly they're a business with your finger on the pulse of innovation in healthcare. That's, I guess, the core of what you guys are about. What are some of the key challenges you're seeing and, that are leading healthcare? And what are some of the key challenges that you're seeing amongst leading healthcare institutions and trusts, the challenges that they might have to seek out new ways of working, for example?
Well, I think the primary ones are obviously the ones you started out with. The effects of the pandemic, the restricted budgets, the rise in demand, terms of both people becoming ill during the pandemic, but also the increase in the backlog, and the fact that there's fewer clinicians, fewer care professionals in order to who are able to service that demand. So it's the healthcare. Well, health and social care as well. So let's not forget that. Health and social care services are being pressured from all directions, and in order to address those, innovation in the way that people are working, but also innovation in the tools that people have to do that work is really necessary. Now, I think there's two obvious areas that people talk about more than any, and if I just take an extra minute to touch on those.
Oh no, this is very interesting and relevant.
Okay, then I think one is the adoption of machine learning as a tool to facilitate the clinical decision support, to facilitate population health management, to facilitate the direction of resources in the most timely manner possible. And I think the other big thread that we see a lot of, certainly that I see a lot of, is in the ever-increasing flood of data that comes from patient-originated devices. So from consumables, from a Fitbit, from an Apple Watch, or from the increasing set of home health devices that people have increasingly used during COVID. So, for example, I suspect many people now know what a pulse oximeter is, and quite a few people may have one.
Exactly.
And so this increasing wealth of data, of information that's coming in from sources when previously where it previously wasn't available from, provides both an opportunity and a challenge. And being able to use that data in a way that's clinically meaningful is, I think, one of the big ongoing opportunities for innovation.
Nice. Excellent. I mean, this data subject comes up a lot, and I'm quite keen to drill down on that with you as well in this conversation. There are these so-called technology constraints. What are those that are holding organizations back?
I think that if you look at the technology constraints per se, then certainly in a survey that we did relatively recently, then I'm trying to remember the number. I think it's something like 70-75% of all companies were saying that the biggest constraint they have is making data interoperable. So that's being able to share information in a meaningful way across the health and social care economy.
Yes.
And that's one of the major barriers, both in terms of maintaining an existing presence within the health economy, but certainly it's possibly the biggest barrier to entry for any innovator looking to get into the health tech, med tech space.
Right.
And that's because there's a real wealth of data standards. And those data standards are complex, and it's a very heterogeneous ecosystem. So people, I keep meeting people who say, well, there's this standard called FHIR, FHIR, Fast Healthcare Interoperability Resources. Okay. And the NHS is standardizing on FHIR as a data interchange mechanism. And I've met many people who are bringing new solutions to the market and say, well, if we implement a FHIR interface, does that solve our problem? And unfortunately, the answer is no, because there are many other different facets to interoperability within the very complex heterogeneous environment that is the NHS than just the data content. And even there, properly getting to grips with FHIR is itself a non-trivial exercise.
Right. John, help us to understand this, because interoperability comes up, and it comes up at our annual event every year, and it has come up at our annual event every year since we started having events 9 years ago. Is this problem surmountable, or is it just intrinsic that there will forever be loads of different standards and database structures and platforms and vendors and intermediaries, and unless you have some kind of Soviet-style single provider taking orders from head office, forever you're going to have interoperability challenges? Are we making progress over the past 9 years?
I think we're making progress. I think the landscape in the UK in terms of the imposition of standards that organisations have to conform to was impacted by the national programme when that came and went. And that was seen as the imposition of standards and systems from the centre and didn't work. And so I think there's good reason why the centre, whether it be government or the NHS centrally, has more taken the approach of recommending than enforcing.
Right.
I think what we're seeing now is that with the more broader scale adoption of FHIR-based interoperability standards across various different care settings and across various different systems within the NHS, we're now moving towards a position where conformance with standards is not only recommended, it's expected, and I think it's going to increasingly be enforced, whether that's contractually by the end user healthcare organisations who you might look to deliver an innovative solution to, or indeed centrally.
So from that perspective, there have been lessons learned, not least the earlier attempts, as you've just made reference to, of if you will, central planning and involvement, which didn't work. Based on those lessons, there's less of that, what do you want to call it, enforcement, but more of the recommendation style, which is getting traction from your perspective.
Yeah, I think that's what we've seen for a number of years. But I think what's happening now is that, as I say, the NHS as a central body and as the separate institutions are now saying, actually, we've been recommending and saying we should be using this. Now we need to use these standards, and putting in place, contractual obligation to do so, for example. And I think that will go some way to solving the interoperability problem going forward. The issue, of course, is that there's such a large estate of existing systems that are out there. And it's all very well saying we're going to enforce adherence to standards for new systems, and it's reasonable to suggest that if you're a supplier and have a long-standing set of contracts with the NHS, you might be asked to implement those standards if you don't already do so. But there's still a very large number of systems many of which are a combination of computer systems and people systems, which use other standards, which use other mechanisms of communication. And so this heterogeneous nature of sort of data, the data liquidity, so to speak, is going to be a challenge within the NHS for many years to come.
Yes.
I think really what we're at the point is just the start of a much more structured movement towards addressing that.
No, I understand. That makes a lot of sense. Thanks, John, for that. Could you help our listeners? I'm sure people would love to hear some specific examples. So, for example, how are Intersystems customers using data in some inspiring way for the sake of innovation? And where does Intersystems sit within that situation?
Okay, well let's talk about. Well, okay, let's talk about a couple of our partners. And a lot of what we do is we deliver our own healthcare solutions into the market, but we also provide a platform for people to construct and build and deploy and deliver their own solutions. And we have many of those worldwide. A couple of examples which I think are really pertinent to what we're talking about. Well, the first is an organization called Cognitivity Neurosciences. This came out of Cambridge University, and they have a platform for the early and simple diagnosis of sort of mental conditions, particularly dementia and other related illnesses, which are becoming increasingly prevalent in society today.
Sure.
And the biggest challenge that they faced once they've gone through all the sort of medical device, all the clinical studies, etc., was connecting their application, their systems into the NHS ecosystem, into the healthcare systems, well, in fact, not just in the UK, but worldwide. Okay. And so we initially started at the point of helping them solve that interoperability challenge. And now we're doing more with them in terms of helping them manage the form and nature of the complex data that might be derived from the studies that they're doing. And that not just is associated with obviously results delivery, then you get into questions about registering patients on their apps and this sort of thing, but being able to do so in a way that's seamless and is free flowing. Nice. So I think that's one example. Yes. Another example which is possibly more pertinent to the discussion that we've just had is an organisation called eConsult Health. And they're a software as a service provider, and their role or their focus is providing systems to perform triage, whether it's in primary care or secondary care.
Oh, wow.
And what they do is significantly reduce that upfront consultation time, enabling the doctors or the clinicians to focus on the people who are really unwell. And right. Let's face it, a lot of people who might be referred to a clinic or perhaps go to A&E or even go to their GP, they don't need a lot of clinical care because their condition can be relatively well recognised. The treatments are standardised, and with some monitoring, they can be safely taken care of. However, what the triaging enables the clinicians and organisations to do is to really focus clinicians' attention on those people who really need it. And we see some quite interesting statistics. So I think one example was they did some work at Queen Mary's Hospital in Sidcup where they introduced this triage system, and everybody who goes into the urgent care facility gets triaged using the eConsult system. And what this means from their perspective is that as well as enabling them to focus on the most urgent people quickly, in fact, everybody gets assessed within 15 minutes of entering that facility.
Oh, wow.
And I had an experience not so long ago where I had to take my son to A&E, and it took a lot more than 15 minutes before he was able to be seen. And that's nothing, it's not a problem in the facility. It's the fact that, there was a lot of people turning up and there's a limited number of staff. So the introduction of these sorts of application, which are I think fundamentally innovative, because not only are they addressing a physical problem, which is how do you automate the triage process, but
Right.
they're addressing the personnel and sort of the workflow problem. How do you make the triage process more efficient? And I think what's interesting to me is that the eConsult application addresses both of those. So it not only makes the triage process rapid and reliable, but it also enables everybody to get through that more quickly.
Yes. That's interesting, because, of course, on the surface it seems like a simple issue. You know, the act of conducting a triage exercise, for example, as patients are arriving in a primary care or emergency hospital department environment. But there's a lot behind that, isn't there? And so once again, these issues of data and interoperability, I'm sure, are quite important there.
Yeah, and it's being able to rapidly obtain, consume, process large quantities of data at scale, combined with the healthcare interoperability that we can deliver. That's meant that eConsult have been able to do some really interesting things, and we see that not only in healthcare, we see that in other markets as well, such as financial services.
Yes.
But coming back to healthcare, I think that the fact that we have something like about what's the number? I think there's about 500 million people's records are accessed by our information exchange running our technology. I think something over 1 billion patient records are stored in our technology worldwide.
Wow.
And I think that speaks to the characteristics of the platform that we have, that really makes it efficient, effective, appropriate to create and deploy innovative solutions using our technology across the spectrum of health and social care.
Nice. No, absolutely superb. John, thank you for sharing that. Would you like to share any other examples or case studies?
I think that one thing that's probably worth mentioning. I mean, we talked about the increased adoption of patient-centric data and the increased consumption of that, and clinicians trying to make use of that. But also, I think it's a two-way street. So it's making more information about a patient's record, about a clinical record, available to the patient, to the citizen, to you and I, and on the basis of that, us being able to make more informed judgments about what we do or who we talk to, or
sure,
how we manage our lifestyles. And I think some of the things, for example, that we've done with people like Apple in being able to deliver a health record into the Apple Health ecosystem, so people can access it via the tooling that Apple provides to integrate with data that comes off my watch or whatever it might be, for example.
Exactly. Yeah.
But also linking it into, as we discussed, the other elements of patient-generated data. And I think that there's some great examples coming through now of people who are managing conditions better with smart home devices that deliver information back to the care professionals about how well how effectively somebody's using a nebulizer, or how effectively they're managing their blood sugar levels, to go back to sort of diabetes level. Diabetes example. So I think there's many examples now of how direct and in significant improvement in care is tangibly being delivered to people.
Yes.
using these types of innovation.
Oh, no, that's a great example. Absolutely superb. And we know that the, what do you want to call it? The home market for monitoring and sensors is exploding, isn't it? Like
Yeah.
you said earlier in this conversation, the fact that because of the pandemic, there's an awful lot of people that probably have a lot more of these devices at home. That reminds me, I remember only a few years ago seeing on Twitter a GP saying, hello, fellow GPs, any advice here? My patient came in to me explaining that they were having sleeping problems. And the patient said to the GP, here's my Fitbit data. And the GP said, well, what's a Fitbit? And I'm not criticizing that GP in any way whatsoever, but iPhones, the internet might not have even been in existence when that GP was at medical school. And there certainly weren't smartphones in the hands of every person nationwide when that GP was a junior doctor, for example, 15 or 20 years ago. So it's interesting, isn't it? An awful lot of consumer-led innovation, which arguably is faster and easier to develop because of unregulation, the consumer market often being unregulated compared to healthcare, which I think quite thankfully is heavily regulated. But you also have disjoints regarding data right there, don't you?
Yes, you certainly do. I mean, there's the data that is collected in an unregulated fashion, which to a large degree has to be firewalled from the clinical record.
Sure.
The clinicians are responsible, or institutions are responsible for the form and nature and quality of data that's in that clinical record.
That's right.
And they're they're held liable as to the quality of that. And so randomly being able to pull into that information that comes from some not particularly well calibrated device that I've bought from a corner shop doesn't really make a lot of sense.
No.
But enabling people to cross that boundary is a real challenge for innovation in the health tech market. Being able to take an innovative device or system through the process of the medical device regulatory compliance and through the process of clinical compliance and the clinical proving the clinical appropriateveness benefits of that device is an onerous exercise. It literally can take many years to do that, and particularly if you're using or trying to use algorithms such as machine learning algorithms to support clinical decision making.
Sure.
And it's relatively easy to deploy those in a setting where you have something that's saying, well, there's something you should look at in this person's record. But if you're turning that into actual clinical decision support and clinical decision making, then there's a whole different level of proof required as to the nature of that. Mm-hmm. And interestingly enough, I think one of the big areas of challenge that's surfacing today is the form and nature of the data that people are using to train their models on.
Right.
And there is an increasing amount of interest from the regulators and indeed from governments about the appropriateness and secureness and the provenance of data sets that are used to train AI models. It's becoming very clear now that legally, if you're providing an innovative health tech solution,
yes,
and as part of that solution, you've undertaken a machine learning exercise, and the model from that exercise forms part of your solution, you have to be able to guarantee the provenance of the data that you've used for that. You have to be able to justify it that it's appropriate, and you have to be able to prove that it's unbiased.
Wow.
And I think we're going, well, there is an increasingly focused set of regulations coming out from governments, both within the UK and the EU, in that regard. And indeed, I saw recently, it was a news article, one of there was a health tech company that whose funding was basically put in peril because one of their major prospects pulled out because they couldn't guarantee the provenance of their data. They couldn't show the audit trails necessary to demonstrate the provenance of their training data, and therefore that major company couldn't take the risk of adopting their product.
Understandable. Yeah, no, that's fascinating. I mean, arguably that level of what do you want to call it? Regulatory requirement is really important. But of course, that in and of itself creates a lot more challenges, doesn't it? John, thank you so much for sharing. I wish we could spend about another hour talking about the subject because I love it and it's fundamental. It's at the center of health and the future of delivering health services, isn't it? But unfortunately, we don't have another hour available, but just wanted to wrap up if that's okay with you. So
Sure.
I wanted to invite you to, take a little look towards the future in terms of what are some of the challenges in healthcare that you and your peers at Intersystems see coming up. And regarding those challenges, how can data be brought to bear to address those? Because I think this is something that you guys are obviously world leaders in, and I'm sure our listeners would like to hear your expert views on this.
Yeah, thanks for the opportunity to say this. I mean, I think a lot of what we do, almost everything that we do fundamentally revolves around the form and nature of data. And in years past, I personally have done a lot of work with different institutions and companies that revolve around getting hold of very many different types of data, turning it into a useful form, and building pipelines to deliver that into various forms of analytics or clinical settings. And I think that as we've just discussed, the importance of being able to do that in a manner that's controlled, that can be audited, that can be monitored, that can be reviewed, is becoming increasingly important.
Yes.
And I think the big challenge is to incorporate the consumer-facing aspects of healthcare data into that sort of controlled framework. To sort of try and close this gap between Fitbit data that ultimately quite often is meaningless to a clinician or they can't take any use of, and data that that comes out of a radiology study in an acute hospital. Being able to close that gap in a way that is both safe, secure, appropriate, timely, that sort of thing. I think that's, to me, that that's really where the rubber hits the road. And if we're going to find innovation in the healthcare data economy, I think that's certainly one of the big areas where there's a lot of work going on. Now, I think the other aspect also that I think is probably the really sort of a massive challenge facing us is come back to the fact the NHS is challenged both from the people resources that it has, hit hard by COVID and hasn't recovered from that, but also the financial resources that it has to deliver services to meet an increasing demand. And so at a macro level, being able to target resources more appropriately where they're really needed, being able to do population health management, population health analytics is a term that's been around for a long time and in some ways has become less favoured because in various ways it's only been partially successful in delivering benefit. So I think what we have to do is look at analytics in the health economy in a different way, but in a way that really enables the ICSs, the integrated care systems, to deliver true value on their constrained budget across the region with which they're responsible for.
Yes.
a very simple example is managing waiting lists.
Yes.
Even then, that's a non-trivial exercise when you're looking at managing waiting lists across different healthcare institutions to much more complex scenarios about
Yes.
Looking at areas of social where is the social deprivation? Where are the people who are finding it challenging to be able to take advantage of healthcare services? What should we do to deliver health and care better, more efficiently to those who really need it?
Exactly.
And I think to me that's an area where perhaps the biggest challenge lies, but also the biggest opportunity.
Nice. Oh, John, that is so interesting and so relevant. So thank you so much for sharing that. Lots of big challenges coming up, but of course, lots of extremely interesting opportunities to address those challenges successfully. So, John, like I said, apologies, but we have run out of time, but thank you for your time. And this has been an extremely interesting conversation. So this has been John Payne, who is from Intersystems, talking about a lot of core issues in innovation and healthcare and issues relating to interoperability, which is an ongoing challenge, and data, quality of data, and so forth. So John, thanks again. Really, really good to have you on, and we're grateful for your time and your valuable and expert insights. Thank you.
Well, thanks, Barry. It's been a pleasure.